Hello, my name is Donetta Etienne, and I will be performing a head and neck assessment today on Mr. Wilson. Mr. Wilson is my patient. He's a 10-year-old black male who complains of muscle cramping and weaknesses after strenuous sports activities. Okay, Mr. Wilson, so today I will be performing a head and neck assessment on you. And in order to perform my head and neck assessment on you, I will have to physically put my hands on you. Is that all right with you?
That's right.
Okay. Well, we're going to start with the inspection of the head. Okay, with the inspection of the head, you check the head symmetry. You make sure the head is round and cephalic. You make sure there are not any bumps, bruises, or lumps, or anything on the head, or excessive dandruff. You check the hair color and consistency to make sure the patient doesn't have any hair loss. Okay, then we're going to go to the eyes. We're going to check the basic vision and the facial expression of the eyes. We're going to make sure that the eyes are asymmetric to each other. We're going to make sure that the nose is in place, that the creases of the mouth and everything is fine, and that nothing is out of place, and that the ears are the exact same size on each side. Okay, then we're going to check the patient's pupils. Okay, we're going to look at the pen light, Mr. Wilson. His pupil is constricted. We're going to look on the other side, look directly at the pen light and see if the pupil is constricted. Okay, we're going to check the asymmetry of the pupils, Mr. Wilson. You're going to follow the pen light from distance to closest to see if the pupils are constricted. The pupils are constricted. They're going inward towards the pen as the pen light is getting closer to the patient. Okay, we're making sure the eyelids are fine. We're making sure the eyebrows are fine. And we're inspecting the inside of the eye to make sure there's no crustacean, leakage, and drainage, which can be indicative of something sinusitis going on. Okay, we're going to palpate and inspect the nose. We're going to palpate to make sure it's non-tender and that you have the firm elasticity. Okay, Mr. Wilson, we're going to take and place your hand on the left nostril. We're going to check your airflow going in and out the nostrils. Can you place one finger on the left nostril for me? Breathe in, hold it, let it out. Okay, we're going to check the other side. Okay, can you take your other hand and hold the other nostril for me? Breathe in, hold it, let it out. Okay, if the patient had anything going on with sinuses or anything, we would take our pen light and we would look up into the sinus area to see if we could find any drainage or any signs and symptoms of infection. Okay, now we're going to check our ear region. We're going to take our ears, we're going to look at the asymmetry of them, make sure that they're even. We're going to palpate the auricles. We're going to make sure there's no warmth, no tenderness, no swelling or anything. We're going to make sure that the lobes are asymmetrical, make sure anything is going on. We're going to take our pen light and we're going to look in the patient's ears and make sure that he have no excessive wax drainage on either side. Okay, his ears are fine. Okay, now we're going to palpate the mastoid processes in the sinuses and we're going to make sure that they have no swelling or anything in the nose or anything. Everything is fine. Okay, then we're going to look at our patient's mouth. We're going to make sure that the mouth and the lips are dry, free from cracks or anything, no bruising, no kind of mouth lesions or anything. We're going to check our lip area. We're going to make sure our lips have no drying or no cracking. We're going to open up. We're going to check our gum area. We're going to make sure we have no gingivitis or any kind of redness. Okay, can you smile for me, Mr. Wilson? Okay. We're going to make sure that if he have any teeth missing, which we have 2 at the bottom, we're going to note the number and the location of the teeth that are missing. We're going to make sure Mr. Wilson has already followed up with his dental hygienist, and if he have any problems, we're going to refer him back to the dentist. Okay, we're going to check our buccal area, make sure we have no white patches or anything on our teeth or anything in our gums. Okay, Mr. Wilson, can you say "ah" for me, Mr. Wilson? We're going to check our uvula. We're going to look at our uvula, say "ah." We're going to make sure the uvula is moved and it is intact. Okay, now, Mr. Wilson, I'm going to use my tongue blade and we're going to check your gag reflexes. Gag reflexes is intact. Okay, now we're going to check cranial nerve number 7. Mr. Wilson, can you smile for me? Frown. Open your, raise your eyebrows and close your eyes. Okay, cranial nerve number 7 seems to be intact. Now we're going to check cranial nerve number 5, which is the nerve of the sensations. Okay, Mr. Wilson, can you close your eyes for me and you're going to tell me where do you feel these sensations at as I touch you. Close your eyes. Where did you feel it at? Where's that?
Forehead.
Okay, close your eyes. What did you feel it at? Okay, one more time. What did you feel it at? Okay, his sensations are intact. Mr. Wilson indeed can tell us when and if any sensation has been touched to the face. Okay, Mr. Wilson, now we're going to do the inspection of your neck. We're going to finish off our assessment. Okay, first of all, can you raise up your head? We're going to palpate your lymph nodes. Right here, we're going to make sure your thyroids are intact. Okay, we're going to palpate on this side. We have no swelling of the thyroid. We're going to palpate on this side. We have no swelling of the thyroid. We're going to check your sternum notch. We're going to make sure everything is intact. Okay, we're going to check the carotids. Can you turn to your left side? We're going to make sure, and we're going to palpate the carotid. Can you turn to your right side? We're going to palpate the carotid on this side. Okay, so now we're going to do range of motion of the neck area. Okay, can you turn your head to the left? Make chin touch your shoulder. Turn your head to the right. Chin touch your shoulder. Okay, we're going to go back and we're going to check the flexion of the head. Okay, can you turn your head to the right, ear touch the shoulder. Turn your head to the left, ear touch the shoulder. Line your head up, chin touch the chest, and look up to the sky. Okay, we're going to palpate the carotid arteries. Can you turn your head to the left-hand side? And we're going to palpate the carotids. We got a strong bounding pulse. Can you turn your head to the left? We're going to palpate the carotids. We got a strong bounding pulse. Okay. During the head and neck assessment, we forgot to check Mr. Wilson's temporal arteries. Okay, so we're going to check your temporal arteries, and we're going to make sure that it's strong and they are bounding and they are elastic. We're checking for elasticity, which your temporal arteries is good. Well, during Mr. Wilson's assessment, we didn't find any hard abnormal findings except the ones that he complained about the muscle weakness and the cramps after strenuous activities. We did recommend that Mr. Wilson hydrate himself with either Gatorade or water, put back his electrolytes within his body, and if the conditions persist, to consult his physician. Thank you, and that's the completion of our head and neck assessment.